Thank you for the organizer for inviting me. It's a fantastic event. I'm very happy to be in sunny Berlin. Today I'm going to talk about VitaDAO and about the achievement since 2 years from its foundation in June 2021. And I'll probably cover some of the topics that have been already anticipated by my colleagues, including Vincent. So a couple of words about my background. I am with VitaDAO, but also with Healthspan Capital, which is a venture capital focusing on longevity, biotech. Capital Cell, crowd equity organization in Barcelona. BIP, which is strategy consulting. And I was formerly affiliated with Ariane Group, making rockets. I left the company basically a year ago in order to focus on longevity. And I've been active in longevity for quite a while, actually. I've done some citizen science as a volunteer with Pedro de Magallanes lab on the genomics of aging, with Colin Ewald lab on the extracellular matrix proteomics. And I've also been involved with the LongGap, which is a fantastic event, essentially an hackathon where anybody can take part and contribute in solving the problems of aging. I'm still affiliated to the Longevity Biotech Fellowship. If anyone here is interested seriously in longevity, I strongly encourage to join. I studied at the University of Pisa, Politecnico di Milano, basically an engineering background with a PhD in bioengineering. So I'm not going to spend lots of time on this slide because I guess I preach to the core. This is pretty well known, it's expanding. But I'm going to give you my point of view on why it's important, why DeSci is important. Well, I guess, as Vincent hinted, DeSci is a way to get anybody doing some work on science, contributing to solving some of the biggest problems around. And that means people from any background and from anywhere without constraint. And that also brings fresh ideas to the field, helping tackle some challenges that have been stagnant for years. And I guess a big example, a famous one, is the first flight that took place in 1903, and that was made possible by two people who were not engineers from a big company, they were two bicycle mechanics. I think that DeSci is important even more for aging, because aging is such a universal issue, frailty, aging-related diseases. Everybody, unfortunately, will have to face them at some point, and so I think it's important that everyone has the right to take action against it. Also, the research into aging, and in particular the companies that are popping up like mushrooms and VCs as well, they're going to generate enormous amount of wealth. And I think that everybody should have right to a piece of the pie, and even more importantly, because longevity medicine will be transformative in the way we age and basically improve the quality of life. Everybody should have access to it. And while VitaDAO is not tackling all of these points, it's a first step. It's a first step at addressing some of them. So VitaDAO, it's been mentioned several times today. Here, in a nutshell, what we have done so far: 20 projects funded, about 4 million, a bit more actually. We now have still quite a bunch of projects under review, and we have 2,400 token holders and 9,000 contributors. So we have gone a long way since June 2021, and it's growing. The specificity of VitaDAO as a funding entity is that we come in very early. We come in earlier than venture capital. We come in a bit later than typical public research, and we're essentially a bridge. So we take promising translational science that has a commercial potential and convert it into valuable IP, intellectual property, that can at some point become a company. And then that company is funded by all the players which are downstream in the value chain. That includes venture capital, corporate venture capital, such as Pfizer Venture. Mike Baran presented 1 hour ago. So eventually what starts with us can make it all the way to IPO or to any other kind of exit. We want to to fund research that can lead to longevity therapeutics, and we want to do it massively. So for us, it's important to put our resources on projects that are relevant scientifically, but at the same time, we want to do so sustainably. In other words, not to have to rely on token holders and strategic partners to fund us, but to be able to generate the funds to fund even more research thanks to returns. We want to make sure that what we fund at some point can generate a return, a good return. And this is why when we receive application or referrals, we apply 6 criteria that ensure that these two goals, these two objectives are basically satisfied. Here you have our deal flow funnel process at a glance. The yellow part is what I just talked about. It's essentially a screening phase. If a referral, basically if an application makes it to that stage, then we work with the founder to prepare a proposal. That proposal is then voted by our community, at least people who have a certain trust level, and then it's reviewed by our community of senior reviewers. We have 50 of them, and the community is increasing. They come from VC, from pharma, from biotech, and of course from academia. So we have a very thorough due diligence process that then enables token holder to make a decision. Because once this process is completed, so phase 2 is completed, we publish on-chain the proposal enriched with the outcome of the review. So token holders can vote according to how many tokens they have. And once an application is successful, it's voted, token holders have said yes, then it becomes a project. We now have about 20 projects, as I said before. We have spin-outs, startups, about half and half. Spin-outs, they're not all technically spin-outs yet, because some of them still are in the lab and need to generate valuable IP, which can then be minted into IP NFT, and then eventually make into company. One of them has already been incorporated, that's Matrix Bio, and I will come back to it a little bit later. Startups are mostly early stage, but we have a couple of ones which are quite close to clinical trials. And together with my colleagues at the Longevity Working Group, in particular Maria Marinova, who will present tomorrow, and Eleanor Davis, who is the deal flow steward, we have put together a dashboard of different metrics to characterize our portfolio and guide us in our future choices. So at the most basic level, we are analyzing what is the split between spin-outs and startups, and it's basically even, which means that it's kind of a compromise between high risk, high reward, and a bit more, I would say, safer bets. We also look at what type of project we fund. Mainly it's therapeutics, like the overwhelming majority is therapeutics, but we are also looking at diagnostics or digital health. And it's usually very early stage, as I said before, so basically in the discovery phase. Now, for those of you who do not come from the longevity space, when you age in your body, a wide range of mechanisms occur, particular damage, that can be classified according to classes. So 12 hallmarks of aging, at least this is the consensus in today's scientific community. It's going probably to change, to evolve. And you want to address each one of them. And the way you do it is with strategies which correspond to the hallmarks of longevity on the right-hand side. So these charts show that we have, with our current portfolio, which is still relatively small, a good coverage of the different mechanisms and of the different strategies to tackle aging. Some of them are overrepresented, some of them need perhaps more attention, and this is a way to orient our sourcing efforts for the future. Most of our ventures come from the United States, no surprise. Many of them come from Northern Europe. We probably need to do some work to attract interesting ventures from other parts of the world, including Southern Europe and Asia or anywhere else good science is made. Now, the go-to-market disease class requires a bit of explanation because the typical playbook of longevity biotech companies consists in identifying a mechanism of aging which can be targeted with a specific intervention and that is relevant for a certain number of diseases, usually multiple diseases, because the mechanism of aging are relatively pleiotropic. So then you make the choice of which disease you bring to the market first, which is important. And that's what this chart is showing. But that by no means is an indication of the potential of this intervention, which can be much wider. Because then, once you have a successful drug for one indication, you can label expand and go into other indication. In the future, when the regulatory path will be there, you might even consider giving this intervention, if they're safe enough, to healthy people in order to prevent diseases rather than curing them. As you can see, most of the intervention are prioritizing skin and cardiovascular, but again, this will probably evolve. We also mapped how well our different ventures are situated in terms of commercial potential and alignment to our longevity mission versus the feasibility and data. Each bubble is a project or a venture that we funded. The blue ones are startups and the other one are spin-outs. And as you can see, most of them cluster in the right-hand upper quarter, which is where you want them to be. There are some outliers, and in some cases there is an explanation, which is that we assess startups and other types of venture using other criteria. For example, company which maybe not be so novel or have big data, maybe they have a great team and we want to bet on the team. In other cases, this kind of representation can tell us that maybe we want to refine the way we make our due diligence. These are some recent examples. Not all of them are super recent, but a couple of them are, of our recent ventures that I wanted to point out to you. And I guess some of them have already been mentioned, and they will probably be mentioned even tomorrow in other talks. But the first project on the left-hand side, the Victor Krolchuk autophagy activators, basically it has been funded a while ago, but the novelty is that we made it into a fractionalized IP NFT. So that's a world first. The second part and milestone is about Matrix Bio, Vergor Bunova project, which was our first spin-out. And I guess Maria will talk about it. And then we have two companies on the right, a Clarity, spectacular company that is one of our closest to clinical trials. And Excepgen, which is a good example of the collaboration between us and Pfizer Venture, the strategic partner that we have in pharma. Basically, Excepgen comes from Mike Baran, and we liked it, we supported it, and shortly thereafter, Ra Capital, which is one of the most important investors in the biotech space, come along. And I finish with this slide with a couple of feedback from the people who apply and who get funded from us. What we are getting as feedback is that we are smart money. We are not just giving cash, but also network expertise and validation to the funded ventures so that they can get money easier. I got an email a few days ago by an academic project that was able to secure funding from the government, thanks also to our letter of support. So with that, I am finished with the presentation. I look forward for any question that you may have.